One of the speakers here at Life Fest Maui is Dr. Mark Emerson, who is a chiropractor with Kihei Chiropractic and also the Sportsman Injury Clinic. Mark, I really enjoyed your talk today.
Oh, thank you.
You know, there's a lot of popular diets out there, those high-protein diets. You addressed it in your lecture a little bit, but the high-protein diets such as the Dr. Atkins Diet, the Zone Diet, what's your thoughts about those diets as far as a person's health is concerned?
John, most of these diets are really geared for weight loss. They're not geared truly for human performance or sustainability. With the Atkins diet, there's rapid weight loss. People, unfortunately, I understand their plight. They would like to take off weight, and who wouldn't like to take it off quick without much effort? But realistically, it's not going to hold water. These folks, majority, will put weight back on because you are not giving the body what it needs. So you get a lot of rapid weight loss. We get a lot of loss of water volume, muscle content. You're going to lose muscle mass. That's where a lot. Remember, muscle weighs more than fat. So when we hear about weight loss, people are essentially talking about weight loss, not fat loss. And it's interesting to point out that the Atkins diet, the Sears diet, the Zone diets talk about weight loss, but they do not talk about fat loss. The best way to get fat loss is to burn fat. One, limit your intake of fat. Use meatless-based sources. Because remember, meat is basically fat. I mean, it really is. 28% protein in red meat. The rest is fat. There's no carbohydrates in meat. So we're really going to cheat our system to think we're going to get nutrients out of that.
So medically and health-wise, what are some of the other downsides of these high-protein diets?
I'm a little perplexed to how these diets came back around. We have great research, and we've shown just through the last several decades, 4 to 5 decades, that these high-protein, meat-based diets are bad for us. I mean, cardiovascular disease still ranks up there in a #1 killer in the United States. Yet these diets that are promoting these proteins is quintessentially cardiovascular killers. Now, Dr. Ornish, his diet was an excellent source of diet. Predominantly vegetation, carbohydrate, and getting some exercise, low-fat diet was actually reducing heart disease. So I'm actually a little perplexed, a little confused to how these came back into mainstream.
In fact, with Dr. Ornish, it was even reversal of heart disease.
Reversal of heart disease. Right. And still, you remember, the human body, for as long as you're alive, has the ability to heal, providing we give it what it needs. Okay, so the meatless diet is definitely the way you want to go. You will definitely lose fat. Remember, we're looking for fat loss. I think everybody is looking for fat loss, not just weight loss. Their immune system is going to be strengthened. Their energy levels are going to be better. The overall, we like to use the term feeling of well-being, but you truly do have a feeling of well-being. You're fit. It's like tuning your car up to the maximum potential. That's what we're trying to get out of the human body.
Okay, so in other words, what you're saying with these high-protein diets, there's weight loss, but there's also health loss as well that goes along with it.
Correct. That's what I would, definitely say. I mean, there's going to be a trade-off, and if weight loss is what you want, I really wish more education was in. These are detrimental side effects that are proven, they're on the books, and you probably are high risk for putting yourself in these categories just for the sake of weight loss.
Thank you, Dr. Emerson, for being with us today, and continue the great work you're doing helping people to better health.
Thank you. It's my pleasure.